Hello everybody. Today I'm going to talk about Parkinson's disease. I didn't realise it, but April the 11th was World Parkinson's Day, so the timing of this video couldn't be better. Parkinson's is a progressive and very disabling neurological disease. I see patients who are suffering from it a few times a year, and they need very careful assessment and treatment if they're going to have hip surgery. Some of you might know that one of our iconic broadcasters, Jeremy Paxman, suffers from Parkinson's. He was in today's Daily Telegraph telling us how much it's affected his life. Recently, I met Maria Lewis and Sally Tawhai, who are physiotherapists who specialise in PD rehab. They've set up an exercise programme called Get Started. This helps people with PD to stay as active as possible. Here's a little taster of what they do.
Hi, I'm Sally.
And I'm Maria. We are going to take you on an exercise journey. Whatever your current level of activity, we are going to be working together so by the end of the program, you can meet your weekly exercise prescription.
In today's video, I'm going to talk to Sally and Maria about Parkinson's. We'll discuss what it is, how it affects people, and how together we can help patients who need a hip replacement.
Hello, and welcome to this online discussion about Parkinson's disease. Now, I see quite a few patients with Parkinson's disease, which is a very disabling condition, a neurological condition, which is very amenable to treatment, but it does have implications for people having hip replacement surgery. So today I've got Maria and Sally, who are experts in physical therapy for Parkinson's disease. And we're going to have a discussion about how Parkinson's disease, or what Parkinson's disease is, how it affects our patients, and how we can better manage this problem, particularly from my point of view, managing patients who are having hip replacement surgery and what problems they might have and how we might help them avoid some of those complications. So over to you two.
So thanks, Jeremy, for inviting us along. We're really excited to be here, both Sally and myself. We're very passionate about Parkinson's and the management of people with Parkinson's and making sure they can really optimise their care and be the best they possibly can during their life. Parkinson's is the fastest growing neurological condition in the UK, in the world at the moment. And 1 in 37 people alive today in the UK will be diagnosed with Parkinson's in their lifetime, which is quite a frightening, phenomenon. So Parkinson's itself, I think most people know about it because of tremor, and they think when you think Parkinson's, you think about a tremor, but it's so much more than that. In fact, there are over 40 symptoms of Parkinson's, and they are both motor and non-motor symptoms. The three real cardinal motor symptoms of Parkinson's are rigidity, so this stiffness that we see, bradykinesia, this slowness in movement, and the third is probably the most common that people, the general public, can think about when they think about Parkinson's, and that's tremor. But it's the non-motor symptoms of Parkinson's that people really struggle with, and there are so many of those. But fatigue, depression, constipation, REM, sleep disorders, just to name a few. So it's a complex condition, and I think the more that people understand about that, and therefore then understand what needs to be done about it, the better. Sam, what do you think?
Yeah, absolutely. As Maria said, we're passionate about it, and as a progressive movement disorder, at the moment there isn't a cure. But where Maria and I come in, and the bit that we're really excited about, is that exercise has been shown that it can control symptoms and potentially delay progression. So at Reach Your Peak, we provide education, exercise programs, and support for people living with Parkinson's, because we really passionately believe that every person with Parkinson's should be their own expert so that they can make informed choices about using exercise to manage their condition. So we have a website, there's an online library of on-demand workouts and programs, and people can choose anything from HIIT routines to stretching, and even laughter yoga has just been uploaded on there at the moment. And we're really excited to talk to you today about how we can yeah, optimize people's care, particularly when there's other pathologies going on, because sadly Parkinson's doesn't preclude you from having other illnesses and ailments as well.
So that's a thing that probably would be helpful to discuss. I mean, what is the etiology of Parkinson's disease? What does it affect in the brain? And why are we seeing this epidemic of it globally? I know we live in an aging population, so people are getting older, and Parkinson's definitely increases in incidence as we get older. But why this enormous uplift in the number of cases that we're seeing?
Brilliant question. with not a clear-cut answer, really. I think there's lots of is a combination of there'll be some external and internal factors. There'll be genetics involved, but then modern lifestyle. It's all going to be influenced. There's a lot of work going on that's really interesting, but we've still got a lot to learn about Parkinson's. But certainly we're seeing more of it. Possibly we're getting better at diagnosing it. That's probably one of the factors. Anything else you would want to add with that, Maria?
Yeah, I think we're getting better at diagnosing it for sure. But I also and the awareness of it is growing. So people are thinking Parkinson's, whereas maybe years ago, in younger people weren't. It wasn't the first thing that came into their mind when they went to see their GP. But now GPs are picking it up earlier, which is great. I think stress and lifestyle. I think people's certainly some of the people that we have exercising with us at Reach Your Peak, you know, when we look at their lifestyle and their jobs, these are people often in very high powered jobs that have been working in stressful situations for a number of years, and it makes you wonder about whether, you know, stress we know it increases motor symptoms, and whether that is having an impact. Also, there's lots of research on diet and industrial pollutants as well, and the impact that may well be having on the inflammation in our brain. So I think it really is watch this space, but with certainly the incidence is growing and will continue to grow.
About environmental and nutritional factors, because they interest me a lot because of the sort of people I deal with having osteoarthritis, inflammatory arthritis. We don't see that many hips coming through these days with rheumatoid disease because it's so well managed by the rheumatologists. The modern drugs, the immunological drugs are so effective. But there's this huge amount of interest now in the gut biome, isn't there? That what we eat kind of affects the biggest brain outside of our brains, which is the gut. The neurology of the gut is enormously complicated. And I have read some stuff that perhaps people who've had problems with inflammatory bowel disease are perhaps more likely to get Parkinson's disease. Is that something you've come across as well?
Certainly something that we have come across, and there are some thoughts around whether there are so Parkinson's almost needs to become an umbrella term, and under Parkinson's, a bit like cancer, we will find subgroups of people, and there certainly seems to be a group of people where Parkinson's starts in the gut. And whether then it's a movement from the gut to the brain via the vagus nerve. And I think that's really, really interesting. So people, as you said, Jeremy, people who have maybe for years presented with sort of bowel constipation, chronic constipation, and other inflammatory bowel problems as well that go on then to develop Parkinson's. There are definitely also a subgroup where Parkinson's very much starts in the brain, or and also in the olfactory system. So whether it comes from our nose and inflammation in our nose and then back to our brain. So this is all exciting research that continues to go to be being done. So I think, yeah, watch this space again, watch for this, but certainly we have lots of people, don't we, Sally, who come to us with a long history of bowel problems prior to their diagnosis of Parkinson's.
Going back to the pathology of Parkinson's in the brain, what's the sort of the common pathway within the brain? What are the bits of the brain which are associated with the symptoms that people have from Parkinson's?
So I think the simplest way to boil it down is it's due to a lack of available dopamine. So the dopamine is a chemical, it's a neurotransmitter, and it helps to pass messages from one nerve cell along to the other. And in Parkinson's, there is a lack of that available dopamine, so the messages from the one nerve cell to the other don't pass as efficiently. I think that's probably the simplest way to put it. There's a lot of complexity behind that. When we exercise, we protect the available dopamine. We used to think we made more. That's not accurate, but we protect that dopamine so that it means that more of the available dopamine is working as efficiently as possible. But essentially, the pathology boils down to a deficiency of dopamine, and that affects the way that the nerves work.
That create the dopamine don't make enough of it to create the pathways or make the pathways work properly. Because dopamine is regarded as the sort of pleasure hormone, isn't it? It's what our brains respond to when we do things which, like exercise. If you do, I've been going to the gym recently, and for about several hours after I come back first thing in the morning from the gym, I feel almost euphoric because of that sort of. I suppose that is the dopamine sort of kick, isn't it, that we get, which encourages us to do it again.
Yeah, and that's what's really interesting, and feeds really into the non-motor symptoms that we see in Parkinson's. No wonder we get fatigue, no wonder we get apathy with Parkinson's, because dopamine, yes, it's a neurotransmitter, so it's really important with movement. But as you said, Jeremy, it also gives us this sense of euphoria when we achieve, when we do something. So when we're trying to work with somebody with Parkinson's and trying to develop an exercise habit, it can be really, really difficult. And we've had people in the past say to us, and family members of people with Parkinson's, we don't know what's happened. Have they had a personality transplant? Because they were used to be really interested in doing things. They were interested in exercise or interested in other activities, and now we're seeing that they're becoming very withdrawn and they don't find that pleasure. But there's a chemical reason for that, and often when we explain that to people, it's really nice, because they suddenly realize it's part of the disease, it's part of the condition, it's not something, they're not being lazy. And we need to look, therefore, externally on how we motivate people, rather than relying on this internal motivation that they've lost as a result of their lack of dopamine.
The interrelationship between, as you mentioned, the gut stuff, but also the emotional factors, and how that can sort of negatively reinforce the problems that people with Parkinson's get, and how you break that cycle. So that brings me onto your program, Maria and Sally. You've developed this amazing program for people with Parkinson's disease. Could you describe how that came about and how it's progressed, and what you can actually offer people with PD?
Yeah, absolutely. So the journey all started. So my background as a physiotherapist is I'm predominantly, or I started off in the sort of sports and exercise medicine world. I run a musculoskeletal clinic looking at sprains, strains, and a patient came in to see me with neck pain, and she was the first to mention Parkinson's. Her mother had Parkinson's, so she recognized some of the symptoms. And she asked me if I thought that could be relevant. And at the time, I honestly didn't know. She went off, she saw a neurologist. The neurologist confirmed the diagnosis. And it still makes me makes my hair stand on end every time I tell this story. But the neurologist said to her, take the tablets and come back when it gets worse. Which just didn't feel like an answer at all. And she came back and said to me, is there anything that I can do? And the answer then was no. And Maria and I were colleagues at that point. Maria was working in the community. She comes from a background in the NHS and rehab and cardio rehab. And I was chatting to Maria about this problem, and it was just pure coincidence. And Maria was like, oh, I'm going on a course. Exercise has been shown to be really beneficial for Parkinson's. And it just kind of spiraled from there. We were doing in-person classes, which were very successful, but there was a limit to how much we could spread that information. We were only 2 people, and we had other commitments to run to. And the idea evolved of trying to do exercise online. This was pre-COVID. COVID, obviously, with all of the many challenges that came along, in some ways opened people's eyes up to online exercise and online healthcare. Our colleagues prior to that thought we were a little bit bonkers, and that just opened up another door. We developed the program. We recognized the challenges that people with Parkinson's have, everything we've just spoke about in terms of motivation, habit forming. So we wanted to go beyond just providing exercise and really think how we can support not just individuals, but kind of community groups, people living with Parkinson's, the extended family beyond that. And that's where it all started. And yeah, it continues to evolve. And yeah, we're just keen to get the word out and get as many people exercising as possible. But it's currently available online. There's a huge library, a growing library of exercises that people can access, and they can choose how much intervention they want, really. So they can pick and choose little bits of exercise, or we can be a bit more of a handhold along the whole journey.
Yeah, and I was going to just add briefly to that as well. You know, I think what is incredibly important is the education element. Knowledge is power. Knowledge is power, and whatever we do, there is an educational thread through our exercise programs, because it's about empowering people. It's about giving them the knowledge they need to exercise for their Parkinson's, because really, when you've met one person with Parkinson's, you really have only met one person with Parkinson's. As I said at the beginning, there are over 40 symptoms, and how any one person can have any combination of those symptoms, and how those symptoms affect that individual can vary dramatically. So it's so important that people understand, yes, how to exercise and what exercise they should be doing, but they need to understand more. They need to understand themselves about their own Parkinson's. So that's really key. And with our Get Started program, which is sort of our inaugural couch to 5K 10-week program, that's what we wanted when we built that. It was to make sure that we could take people on an exercise journey, and then we could take people from wherever they're at, wherever they're starting with this condition, and teach them how to exercise effectively to actually treat this condition, because that's what we're doing, Jeremy. We're exercising people. We are actually treating their symptoms and ultimately slowing down progression. So there's a prescription, and that's what we did when we wrote Get Started. It was all about that.
So from experience, a friend of mine runs a neuro rehab unit down here, and getting access to neuro rehab in the NHS is so difficult. It's so under-resourced, and from what you've explained, this enormous explosion in the number of cases of Parkinson's. How are these people going to access care through an NHS system which really doesn't provide a service for the majority of people? So is your service, I mean, it's a private service, presume, but are people able to access it through the NHS, or is it purely private at the moment?
Work in progress. It's yeah, it's essentially it's self-funded at the moment. We work very closely. We work in partnership with Parkinson's UK, and for other projects that they've worked on, they've been able to give us access to funding, which allows it to subsidise the programmes. But it's something that we're very interested in, is how we can make this as accessible to as many people as possible.
Presuming that you were having discussions with the NHS, perhaps to offer a service for NHS patients subcontracted to you. I mean, that would make enormous sense. And with the NHS in the state it's in, there will be opportunities, I guess, to bring in private providers of services like this, which the NHS can't do.
Yeah, we hope so, and we hope to, it becomes a pathway, because that's what we're looking to build. We're doing some really lovely work at the moment, working with local leisure centres, and this project, we've had some funding through Parkinson's UK to do that, and it's a hybrid project. So that way being able to combine exercising online with exercise in the community in a class. There's education of the exercise professionals too that we provide, so that there becomes so once they've finished our Get Started program, there is an exit strategy, and there is a sustainable exercise for life provision for them within the community, and that's what we're currently really working hard on, that and to be able, and then to be in a position to be able to roll that out throughout the UK, so it's available on people's doorsteps for them.
Editing personal trainers and other physiotherapists to be able to offer this sort of training would seem to be a very attractive model for that, wouldn't it?
Yep. So we've just had that approved recently, actually. So SIMSPA have approved a training course that we're rolling out. We've got the first one that we're delivering in May, and that will be an ongoing process to train people and hopefully help people feel a little bit more confident when they come across someone with Parkinson's. Because certainly for me as a healthcare professional, before I got involved in the Parkinson's world, it's something that we don't know a lot about. For us, as you know, when we were training as physios, yeah, we came across it, but you may not encounter that many people. The reality is that we will come across more people with Parkinson's over the next few years of our careers. But for exercise professionals and healthcare professionals that are not normally in that world, it can be quite daunting. And just what we want to do, again, like Maria say, we want to educate the people with Parkinson's, but we also want to educate those people working with them, so that it's just one kind of seamless provision, really, and everybody's singing from a similar hymn sheet. But so you've talked about some experiences where you've had patients, and you know, the rest of the staff on the wards are gonna meet these people too. So if we can just debunk some of the scare.
Seen quite a few over the years, because people with Parkinson's get osteoarthritis of the hip. You know, they're no different in terms of what they get, and they do present some challenges to me as a hip surgeon. Primarily, anyone with a neurological condition is more at risk of having a dislocation of their hip replacement, particularly in the post-operative period. Whilst they're getting used to their new hip, they may have balance problems. And I saw a patient recently. He had quite severe Parkinson's with a very bad hip. So we did the hip replacement, but he had an acute confusional state post-operatively, which was very, very upsetting. It took several weeks for that to settle down. So we had to transfer him to an acute hospital where he was for several weeks because of this acute confusional state, which of course then had a terrible impact on his ability to rehabilitate from the hip replacement surgery. So it has a big effect, and I see a number of patients, and your program, I think, would be very helpful, particularly in terms of allowing them to do a bit more exercise, which will help reduce the risk of problems post-operatively. So prehabilitation, I think, for these patients is really important, and they just don't get it at the moment. So that would be something I think would be a very worthwhile thing to do for anybody with a degenerative condition or any surgical condition, having preoperative rehab to help them get better quickly and reduce the risk of complications. Is that something you can do, and specifically for those patients?
Yeah, absolutely. We work with an amazing production company who specialize in content for fitness, exercise, and the Get Started program that we spoke about when we filmed that. We wanted to make sure that there were a sort of higher and a lower impact option to both of those. So with the program, there's a seated option, which will be useful for anyone if their Parkinson's symptoms is making balance a difficulty. But if you've got a joint condition, you want to offload the joint slightly, then the seated option, as a kind of build up to surgery, you know, we're going to optimize not only their Parkinson's symptoms, but optimize their cardiovascular fitness, their muscle strength, which we don't need to tell you will help when they come out of the post-operative period.
Situation, doesn't it? I mean, upper body strength is often ignored in prehab, and these patients are going to be using a Zimmer frame and crutches post-operatively, and often they're coming into surgery, particularly the older people, quite defunctioned and deconditioned. So anything we can do to improve their condition coming into surgery is a good thing.
And I also think, Jeremy, is it's important to prepare them preoperatively for so as much information as possible, but also to be aware that stressful situations in Parkinson's make things so much worse than somebody without Parkinson's. So their motor symptoms can be much, much worse if they enter into a stressful environment. So again, just being aware of that, and being aware that there are new symptoms like confusion or what can just suddenly appear, like you said with the person that you had in, Jeremy. It's very, very common. So stress, infection, fatigue, sleep disturbances, surgery, new meds, they're all going to have an impact on how that person with Parkinson's and their motor symptoms. So, and to a point where they may feel like they're completely frozen.
Yeah, which of course is terribly detrimental to their post-operative progress and increases the risk of all sorts of problems, particularly dislocation, wound problems, respiratory and cardiac problems as well, deep vein thrombosis. So huge implications of that, aren't there?
Absolutely. And I think another really important point to make is about their meds, their medication, because when you have Parkinson's, it is absolutely vital that you take your medication on time. And I'm sure could be a huge challenge. It's going to be a huge challenge when you're thinking about, having to starve somebody before they go to theatre and all their timings of theatre and their timing of meds. But they really that needs to be all pre-planned, and it needs to make sure that they're able still, if possible, to get their medication at their allocated time, on time, and if not on time, but as soon as they possibly can, because it will have a direct impact on their access of movement.
This patient I've got awaiting surgery at the moment, I've referred him to a neurologist to optimise his condition before surgery, and that was made very clear that we have to give the medications very close to the usual time, otherwise it causes things to go out of control very quickly. So where can people access the service? Where do they go to sort of get into your program and get more information about it?
So the website is reachyourpeakonline.com. And from there, there's information about the exercise programs, the education programs that we offer. We have a handbook, an exercise handbook, which is our kind of everything you need to know about exercise. And that can all be accessed through the website. Our contact details are on there as well. And we're always happy to answer any questions that anyone might have, even if they're not directly wanting to get involved in exercise just at the moment.
In the description of the video below, so that's great to have that information. Well, that's been fantastic, really informative, and a very topical problem that we're all facing. There are quite a few celebrities out there with Parkinson's, aren't there?
Yeah, there are. We've got none of them on our program yet, though. Actually, I have a not a celebrity, but we just finished exercising somebody who is a movement disorder specialist with Parkinson's. He's always been a big fan of ours, but he's even more of a fan now because he now realizes how important exercising is for Parkinson's, and he's living proof of that now. So yeah, it's great to have advocates out there who are in a position to really spread the word about the importance of not just working with us, but the importance of exercising generally for their Parkinson's.
It's been an absolute pleasure speaking to both of you and hearing about your wonderful work. We'll spread the word far and wide, hopefully.
Thank you. Thank you so much.
Well, if you stayed the distance, I hope you found that interesting. Sally and Maria have developed an amazing programme that will help many patients with PD. Their work will also help more of us to be aware of this disease that has such a profound effect on people, their friends and families. I'll put the details of the Get Started programme in the description. If you've got any questions, then please get in touch. Thanks for watching, and I'll see you all again next time.